Hi, class. So, my policy and presentation are on supervised consumption sites. Supervised consumption sites are locations in which individuals suffering from substance abuse can use their substance of dependency with the supervision of medical and public health professionals. I chose this policy because, as someone who used to be an addict, it's very near and dear to my heart, and I've lost a lot of people close to me over the years that suffered from substance abuse. As far as stakeholders go, it's individual addicts, their families, friends, communities, healthcare system, criminal justice system, political leaders, the economy. It really has started to affect a lot of our system. So in 2022, 17% of the population reported to be struggling with substance abuse, which is a lot of people. That's almost 1 in 5 people in the United States. And 1 in 8 know someone who have died from an overdose related to substance abuse. 2022 also had the highest number of deaths on record in the United States at over 100,000, and it also had the highest number of deaths on record in Vermont as well. One of the problems is fentanyl, which is a opiate analog, which is normally used in anesthesia. It's very potent. It takes only a little bit to have an effect, and it is very easy to manufacture and transport, which is why it started to kind of phase out some of the older traditional black market opioids like heroin. Also, drugs like xylazine have made their way into the black market, which is a veterinarian aesthetic, which adds even more danger. Vermont has one of the highest rates of drug abuse in the country. Um, in 2022, a safe injection site bill was vetoed by Governor Phil Scott, and he argued that there wasn't enough data, which is to support passing the bill, which is I don't think necessarily true. In 2024, the Vermont House passed another bill for safe injection sites. Clearly, there's a need. Um, I think that supervised consumption sites. One advantage of supervised consumption sites is that it is more palatable as a concept, um, and it also includes all drugs and not necessarily just intravenous usage, which would open up the doors for more people to come in and take advantage of the site. Um, so advantages of supervised consumption sites are they provide a clean, sterile environment with medical supervision for individuals to use their drug of choice. Um, they have been shown to decrease overdoses, disease. They decrease strain on emergency health services, on the healthcare system. They reduce crime. They decrease strain on the economy. There's less public use of drugs, and so that means less syringes out and about. Um, and while a client is entering a supervised consumption site, they are able to be funneled into other services like housing, healthcare, food assistance, treatment, rehabilitation. The goal isn't to just keep them there. The goal is to help them at the same time. It's just one way. Supervised consumption sites in have been shown basically. Um, they have shown that though if people can survive long enough, they eventually get sober. And the first sites were in the Netherlands, and then there were some in Philadelphia and Vancouver, and they've all shown all of those advantages. Decreased overdoses, disease, death. So one of the disadvantages particularly when it comes to Vermont, is it's rural. Um, People would have to travel to a supervised consumption site, which could reduce the amount of people who could actually attend one. One solution to that is the Never Use Alone program, which is a number you can call and have someone come stay with you while you're using your drug of dependency. Um, the other disadvantage is that a supervised consumption site does not provide pharmaceutical substance. So the black market substances are still going to be used, and they can be just as dangerous regardless of having medical supervision. So in other sites, in other places, they would provide a replacement therapy like heroin, pharmaceutical grade heroin, or methadone or something like that. A couple threats to this policy, which we've already experienced, is philosophical or ideological objections. People, citizens, political leaders may view them as enabling addicts and taking away from other harm reduction resources. But it's not a zero-sum game. So you can do both. You can have other harm reduction strategies and you can have supervised consumption sites. And the truth is that they are not enabling, that they help people get off of drugs. So that's what supervised consumption sites do. They help them get off of drugs and they help them survive while they're using. Which is kind of the goal. One of the other threats is just funding, but I don't think it's necessarily an issue, because if you take into consideration the money that could be saved on the criminal justice system and the healthcare system, then it would probably make up for the cost of a supervised consumption site and the medical staff that are in it. So I think in general, supervised consumption sites are a more palatable term compared to safe injection sites, which Governor Scott vetoed in 2022, and he may veto again in 2024. So I think supervised consumption sites would be a better option as far as terminology and effectiveness as well. Because more people will be able to use it. So in conclusion, I really believe in this. I think it would save a lot of lives. You know, I've experienced the lack of treatment options and harm reduction strategies that addicts have to deal with, and as well as the stigma. And I think supervised consumption sites would go a really long way in reducing both the stigma, overdoses, deaths, and harm in general. And that's my presentation. Thanks for watching.